I'm going to tell you, get used to the word or the prefix spondyle, because there's spondyle everything. There's spondylosis, spondylolisthesis, spondylitis, ankling spondylosis. You know, there's a little bit of everything. Spondyle is Greek for spine, something to that effect. So this one took me a while because I kind of self-taught myself to read MRIs. Thank you, Google. And I'm like, what is this spondylosis thing? Like, this sounds horrible. Spondylosis is another word for osteoarthritis. So just throwing that out there for you. And osteoarthritis is common. I'm just going to say that. And I would say it's common in older people, but it's common in athletes. It's common in people with poor body mechanics, maybe desk sitters who are constantly, you know, applying weight in areas that shouldn't be having it. So if you have really lousy posture and you're kind of, the vertebral bodies might start to push into one another. This is another famous, you know, this back cage, there's a lot of little joints in through here. Every connection point of the vertebral bodies is a joint. It's a compressive joint. But then you also have little joints out on the side. There's not a lot of room here, and gravity has an effect on us our whole life, tracking us down. If it starts to get a little bit of misalignment, then you start to get bone rubbing bone. Bones are awesome. They will rebuild. They're this living tissue. What's not awesome is they will rebuild when they're getting pressure put on them in a place that shouldn't be building. And to me, osteoarthritis is a kapha issue. It's excess tissue growing where it shouldn't grow. How can we work with osteoarthritis? Axial, I'm going to say that any question I ever get, axial extension, movement to imbibe the discs with fluid. So movement in all directions, but always getting that length before you go over. And I'm going to say this too, because people say, oh, I can only do a little bit. Movement is movement. Start where you're at, and over time it will increase. But if, just because of how I'm sitting, say I have osteoarthritis in my neck, this is movement. Inhale, lengthen, exhale. Inhale. That's affecting change. It's very slight, small movements, but it's movement. So I'll never kind of forget how profound, and we did a lot of this in my training where we do very gentle movements linked to breath on one side of the body and then notice the change, and it was profound. So never underestimate the value of very, very gentle movements linked to breath. It can impact huge amounts of change. Even just deepening the breath can help a lot, especially if someone's in chronic pain. So osteoarthritis, bone growing where it shouldn't grow. Sherry and I were at a training in Chicago a few years ago where we were teaching, and there was one of our students who had been out to California. We were in her neighborhood, you know, near her, so she came down. Unbeknownst to us, she was a chemist. And so I was explaining how with osteoarthritis, the body can resorb some of that. And there was a woman kind of looking at me like, and I just stopped. I said, are you looking at me because I'm not being clear, or are you looking at me because you disagree? You know, like I just want to, she goes, no, I just don't understand how that could possibly happen. And so the woman who had come down, who knew us from before, she goes, let me just explain it. And I wish we had it on film because it was so awesome how she explained it. Anywhere there's fluid, chemistry can happen. So if we're doing movement here and there's little bone growths on here, the body, I'm not saying you're going to get a 96-year-old with advanced osteoarthritis to look like a 19-year-old. That's not what I'm saying. But the body can start to resorb some of that excess bone and move in the direction of positive change. That's one aspect. The other thing is you can delay the progression. Working with someone's alignment, working with engaging the core and strengthening the core so that, you know, other muscles aren't being recruited to do different jobs. A lot of times the QL, the quadratus lumborum, that big thick one in the back, that one is overworked and underpaid, and you'll just see like this kind of gripping. So always, you know, loosening that, which can happen fairly quickly, I mean, not in one class. I mean, you'll get it a little bit looser in one class, but over time, you'll get that flexibility back in the muscle, and then you don't have both muscles or even just one side pulling down and creating that misalignment, creating more bone.